Okay, welcome back to another episode of What's Up, Docs. We're back
What's
this
up,
week.
Doc?
What's up? What's up, Doc? We still know what's up. It's COVID. Uh, that's what's up. I think everyone in America, everyone in the world is pretty much. This is what we're all talking about, not just physicians, uh,
Right.
but we're kind of on the front lines of physicians. Social media, we're seeing what's happening, what everyone's talking about,
Mm-hmm.
and this week. So we last talked last week, and obviously the number of cases has increased significantly. Um, from last week to this week, we see New York as now, New York City specifically is, it looks apocalyptic. There was a video that went viral just, I think, last night or the day before from Elmhurst Hospital in
Mm-hmm.
Queens.
Mm-hmm.
They were talking about, they shot video where in a COVID unit, and they talked about, refrigerated trucks outside to bring the bodies. I mean, whew, it was unbelievably depressing to see that.
Yeah.
Um, what is interesting is there's the dichotomy of what physicians and other healthcare professionals who are on the front lines are talking about on their various groups, and then there's another group of healthcare professionals. Somehow I'm in the dental investment group, and a lot of them they talk about finances and things like that. But somehow,
Hmm.
as everyone's talking about this stuff right now,
Mm-hmm.
there's a vocal segment who are pretty uh, adamant on believing that we should not have shut everything down, and that
Hmm.
we, yes, it's in New York, but it's not in other places. So it's should we, have shut everyone down? And
Well,
it's tough because I get it. These people are losing income, losing jobs, stuff like that, and they don't have cases in their immediate vicinity. But and I'm sure you're gonna, you could explain this probably better than I can. But I was like, well, yeah, but you can't control who's coming into your office then.
yeah, and also it's not in other areas of the country right now because we shut things down, right? That's so yeah. It's in hindsight, it's gonna look like we overreacted, and that's the whole like.
Well, I don't know if that's true. I don't know if that's true.
Yeah, well,
Only
that's true.
yeah.
Yeah,
If we are successful 2 weeks ago, it would have looked like that, and we
right.
weren't, right?
Yeah.
And you're absolutely right. Like if the nation would have shut down 2 weeks ago or 3 weeks ago, things would be a lot different now. But we didn't, and individual states may have, but and for the most part, people I think are trying to socially distance, but it's a very, you know, a lot of people are like, well, this I'm socially distancing here, but I'm not here, So you go to, they said last week, I think in California, the beaches were packed. We saw pictures
Mm.
2 weeks ago or 10 days ago in Florida, spring breakers, right? And here in Arizona, hiking is a big thing, a lot of trails outside. And because everything else is shut down, people are packing these trails. So
Hmm.
not really possible to socially distance, And I
Yeah.
think the average person doesn't seem to quite grasp, but I was a little disappointed in the arguments. I understand the economic difference, in between practice owners and employees and things like that, and those maybe in New York City and those in Idaho or wherever. But what I couldn't what I was upset with was the lack of scientific understanding. It was like
Right.
they're like, we don't shut down for uh, you know 50,000 people die of heart attacks, whatever. We don't shut down. I was like, yes, but heart
They
attacks are
don't do
not
it
an
at the same
infectious
time.
disease, and they don't do it at the
Right.
same time. Exactly. I was like,
Yeah.
just basic. What's so tough to understand about that?
Right. Yeah. The reason doctors have been freaking out about this is it was looking to all hit within the same 1 month, 2 week time frame where you would get this huge amount of surge of a whole yearly, death allotment happening within 1 month. And that's when or infection allotment happening within 1 month. And that's when a lot of people die because we don't have enough resources
Right.
to save everyone.
Yeah.
And that's why everybody's been freaking out. But yeah, and I totally agree. Like from an economic perspective, for people that don't understand this stuff, I can understand their frustration. But then again, it is so important that we try to reach those people, because if people aren't socially distancing, it's, if half the country is doing it and the other half is not, well, we've already clearly reached the point where the United States has more cases than the rest of the world. I mean, we're doing a terrible job at this, even though we're trying so hard here in New York. And I gotta say, Governor Cuomo is doing an excellent job of leading the state, and really he sends out an email every single day with updates, and seems to be really trying to pull through for us, and I appreciate that very much. But we
Yeah.
need that kind of leadership throughout, unfortunately.
True. And again, I think it's, if we're not getting it from the federal level, then we need it from our governors, our mayors. There was criticism of Cuomo and de Blasio for not closing the schools early.
Right, earlier. Yeah.
Yeah, earlier. Sorry, and I
Yeah.
think that is warranted, criticism,
Yeah.
and so I mean, I'm not sure that anyone in any leadership position has ever had to brace for this type of stuff. So,
Right.
I don't care how you feel about the president, pro or against. He's very polarizing. Very few people are feeling neutral about him. But I don't. The truth is that no, I don't think anyone would have known what to do exactly. On the flip side, some other leaders may have made other Americans feel better, and that's but neither here nor there. The actual policies are what matters. So they passed
Yeah.
the stimulus bill yesterday in the Senate and today in the House, $2 trillion. And so they talk about 100 billion is going to the hospitals. I'm going to have
Mhm.
you let's see share the article. If you have it there, or I can share it if not.
Let's see.
Oh, actually,
I
I
might
have
have
it
closed it
here.
out.
I have it here.
Okay.
So
Okay.
let's see. Share screen. Here it is. Okay. So this is on from Politico, but New York Times, a lot of Wall Street Journal all have it. The interesting thing is, so for the big issue that I think those dentists and probably a lot of private practice physicians had were, are they going to be able to make up losses for closing their offices? I don't know. I mean, if they lay off their staff is eligible for unemployment, which gets them an extra $600 a month. But further down in this, I think we saw something about, yeah, here we go. Businesses that retain their workers during the pandemic can get a credit for about half of what they spend, up to $5,000 per worker. But you have to show a 50% loss compared to last year at the same time. So probably not going to be super easy. And many businesses, many practices, could probably sustain a few weeks to a couple of months. But beyond that, cash flow is difficult. And most practices don't, retain 3 to 4 months of cash flow. Even most hospitals don't retain that kind of stuff. So I think we're
Mm-hmm.
really going to start seeing a hit there. On the hospital side, they did say that, let's see here, hospitals get $100 billion, which is what they wanted, and because they're trying, they're losing revenue from lost elective procedures, which is where they make a lot of their money, right?
Mm-hmm.
And they're going to get a potential, looks like a 20% bump in Medicare payments for treating patients with COVID. So, I think it's important. I hope the money, of course, is going to hospitals, and who controls that at the hospitals is the administrators. I hope they work their way down to pay their staff, and I really hope they pay bonuses to their technologists, transporters. A lot of the staff in the hospital that don't get high salaries, but are exposed to this. The janitorial staff, nurses, respiratory techs, all these people are really highly exposed, and they don't make incomes that physicians do. So, if anything, I really hope that they help treat those people really well. The flip side, there was rumors going around social media last week about a hospital in I think Cincinnati that was cutting salaries for physicians. I don't know if you saw that one or not. Uh,
Yeah, I hear of that a lot, in a lot of different places. And, that is such a shame. And I really do hope that the stimulus will make administrators feel more comfortable with supporting their physicians as well.
right.
Um, because unfortunately, with the stimulus bill, that's based on salaries from last year. Um, a lot of the doctors that are going to be losing income as well due to this coronavirus, but because the stimulus bill is based on last year's salaries, they're not going to qualify for any of the individual or family
Oh, you
payments.
mean yes, the subsidies
Yeah,
that are coming directly, right, right. Most
right.
would not qualify.
Yeah. And and I will say, like, physicians are frontline as well, and what I have been thinking about recently is the difference between the army in this situation and like what the healthcare field as we know it currently. My husband was deployed or in the army during Ebola,
Mhm.
and the amount of infrastructure and the support that we had as a whole family from the army was really quite incredible. As compared to what's going on now, we had pre-deployment and many months of family meetings, where we would go in and meet with the leadership of the entire company, and a lot of information would be given. There would be financial support. There would be, people talking to you about wills and estate planning, and there were people making sure that they knew everything about the family and the family was supported while they were gone. There was psychological support for the families, um, and a lot of just you felt like you were part of a big family that was taking care of each other and that was also taking care of the world.
Right.
And that kind of feeling is really missing in our health community right now. I feel like a lot of doctors are making fear-based decisions and really afraid because they feel unsupported, from many different lines, and a lot well, first, the lack of PPE, that's huge. But of
Yeah.
course, the community is, really coming through with trying to sew stuff and things like that. And that's wonderful. But I think from like the administrative portion of it too, it would be really important for the entire healthcare team to come together at this time. And I would love to see something like what the Army does for the healthcare team, where the leadership is really focusing in on the families and making sure everyone's needs are covered. They're getting emotional and financial counseling, so that everybody's families are taken care of should the worst happen, and those kind of things.
I agree. I mean, the Army is a great example. The military's done amazing jobs from a long, time of experience. Hospital, they don't really have experience with maybe isolated areas do, like Las Vegas during the mass shooting there, or New Orleans,
Mm-hmm.
Katrina. So pockets of experience that then kind of filter their way around. But we're in a scenario now where the entire nation is, I mean, it's happening in different speeds everywhere, but the entire nation is under threat. And
Mm-hmm.
the issue for hospitals was that, you know, they were trying to get leaner and leaner and leaner up until this happened, and you know, with their costs, so supply chain things like that, they actually pretty much the whole business world went to just in time supply. So you order it and you get it, right?
Mm-hmm.
And it never occurred to anyone that everyone would order simultaneously.
Right.
And so, I'm not gonna. I mean, yeah, I agree. I wish they would be support, and I think I see some aspects of that now, where hotels in the community here in Arizona are giving free rooms to ER physicians and first line medical people, so that they don't have to go home and potentially risk infecting their family. So that the hotels,
Oh,
no one's using their hotels anyway, right? So it's
that's
great
great.
support from the community. I think probably similar things are happening in New York. I know in New York, because there's such a shortage of physicians now and healthcare workers, or there will be,
There
there,
is, there is.
yeah, there is, that they're basically allowing anyone to come in, and they will, from any state, and they will get your, a New York license within a day.
Wow.
And it's good, and it's unfortunate. I think it's a good thing that will happen after this crisis is over, is that we're seeing now how much of this administrative layer is unnecessary and has
Mm-hmm.
proved to be detrimental rather than useful during this crisis. And
Right.
so I hope after this is done, that's one of the positive things I'm looking forward to, that, you know, a lot of the administrative bloat will be removed from the hospitals.
Yeah.
What can I
Yeah.
hope?
Well, not that, we want to put anybody out of a job. It's just that there has been a complete upturning of what should, in my opinion, be um the priorities for hospitals. I've heard stories about doctors being asked not to wear PPE because they're scaring other people. That's happening all across the country,
Right.
coming mostly from administrators that are not at the bedside and not exposing themselves. So I mean, these are the kind of things that the people that at bedside understand better than administrators. And so, yeah, so we need to be talking about this stuff. And I'm hoping that, this crisis will result in, some correction of that mismatch.
I think it will. I think it will. And I think that, it would be nice to see, we see a lot of medical staff from nursing, from technologists that move their way up into the administrative levels. It would
Mm-hmm.
be nice to now see more, as they get more senior, right? The people with the most experience then move up to administration, and you lose that level of knowledge actually taking care of patients. It might be nice to see a reversal of that trend, right?
Right.
I mean, we need those people, some of them in administrative, but I always say we don't need that many administrators. I always wonder, where's JCO now? What is all that stuff that we all worry about during JCO inspections and, JCO ratings and pre JCO screening meetings, and then when they come, and none of it means anything now. You know,
Yeah, I guess I don't know if you can eat through your PPE, but you can try.
I know, I know. So yeah, it's scary. One of the things that some of the physicians in my Facebook group, and I'm sure you've seen this too, that have reached to me about, is during this time, they're concerned. And one of the things you said about the Army, they came and talked to you about, making wills and stuff like that. And it's a question. I mean, it's a thing that we all know to do, but you didn't think it was going to be something directly at work. And now we're starting to see, right? A number
Hmm.
of physicians have already, died worldwide. A smaller number, but a growing number have passed here in the U.S. And I think a stat that I saw this week, 16% of those infected in Ohio were healthcare workers. Uh,
Mm,
in Italy, it was like 9 to 10%. So
right,
it's coming.
right.
Um, and so it's a concern that we all have, and it's something that this is the stuff. You're right. They should help facilitate those things, and if not, at the very least, you can get on LegalZoom, and or one of these other companies. I have no affiliation with any of them, so make something out, because it's better to have something written somewhere.
And most hospitals and employers do have a legal option when you're picking your benefits. So sometimes you can reach out to the legal team at your work from your HR,
Mm.
and they can direct you. As we got a will done for free through my husband's legal service that way. So
Right,
that's a cheap way to do it
right,
if
right.
you
Yeah.
can get it
Yeah, I
done
mean,
too.
yeah, it's really important to get stuff like that done. And I know right
Yeah.
now we're kind of in the thick of things, so it's hard to think individually, but it's at the same time, we're also, thinking of our families. So when you come home, you don't want to risk them.
Right. And honestly, I've been thinking, I've been recently trying to pick up some hospitalist shifts because I feel I've recently transitioned from hospitalist to primary care, but a couple of years ago, but I still have the skills and I'm, in my 30s and I am, probably the least susceptible to this illness, so you feel kind of a moral obligation to step up and help. But and I went outside with my kids a couple of days ago, and and kind of got things in perspective, and I was really thinking about like how thankful I am that I recently got life insurance.
Mhm.
My husband and I have enough life insurance to take care of everyone. We have disability insurance, we have a will, like I feel half the weight lifted off my shoulders just knowing that they're going to be okay, you
I
know.
think, yeah, that's important. Someone actually during this stimulus package negotiation, someone tweeted out, and I don't think it made it to the stimulus, but obviously I haven't looked at all the details. But it would have been a great thing to have, you know, built-in life insurance policies passed for every healthcare worker who
Mhm.
is at a hospital right now, just automatic. So if you,
That would have been great. Yeah.
and what the amount is, maybe whatever, but like it would have been nice to be like, hey, we're thinking of you guys. We really want, we appreciate the work you guys are doing, and we all know term life insurance is not super expensive, and they
Mhm.
could have probably just been like, hey, you know, cover them for this 90-day period or 1 year going forward.
Right.
We'll buy a
That would have
policy
been so
for them.
nice.
It would have been an amazing show of gratitude to the frontline healthcare workers. But we'll see. I mean, like I said, we're still in the thick of things. New York is obviously is now the epicenter of the world, along with Italy and Spain, as far as severity goes. Here, I'm in Arizona. Uh, we still haven't seen I mean, the numbers are definitely going up, but we're pretty slow in our testing. So a lot of people kind of feel like it's still not there who are not in the hospital facilities. But those of us who are know that even though the official counts are low because of the speed of testing, we know that there's a lot more people who are what they call persons under investigation, or are under interest. But basically, it's 10 times the amount that really the numbers are there.
Right.
So
Right.
you know, we're probably where you guys were last week,
Right.
or maybe 10
Yeah.
days ago. So
Yeah. I mean, the calls from the governor for volunteers to the city are daily now,
yeah,
and I think a lot of people have stepped up, but they're just asking for whoever can help to get down there because it's terrible. And this is what we anticipated like a week ago,
yeah,
right? But
yeah,
a week prior to that, never thought that would happen to us either,
yeah. No,
right?
it's amazing. I mean, again, I think it's 2 weeks ago, or 2.5 weeks ago, that letter from the Italian physician
Mm-hmm.
came out,
Two and a
and
half. Yep.
yeah,
Exactly. Yep.
and now literally the video could have just been, the American version of exactly that same thing. In fact,
Right.
just last night or this morning, I saw. Again, bear with me. I'm not sure if it's exactly accurate because but I think Henry Ford Hospital in Detroit had guidelines, and not saying that they were applying them, but basically how to decide in ethical situations here if you are running low on ventilators and
Mm-hmm.
ICU beds.
Mm-hmm.
And it's, I mean, I'll be honest, kudos to them for making a little bit of a proactive thing, because people are basically making these decisions on the fly, right?
Right. And, you know, and malpractice lawyers are kind of also gathering, you know,
Yes.
right now. I've seen posts of them asking for, you know, hey, if you feel like you got coronavirus in the hospital because someone wasn't wearing adequate PPE, then,
Right.
you know, you come to us and we'll help you sue them. Like seriously, you
I
know,
know.
like we don't have adequate PPE in the country, and this is a problem. You know, it's not like people are trying to pass the virus around.
Right.
um but you know, can you imagine the repercussions for physicians and people that are making the decisions to, if they decide not to intubate someone, you know,
I
like that
know.
kind of that.
Yeah. Yeah. That exactly should be an institutional policy.
Right,
And
right.
unfortunately, right now, have passed the buck on to their physicians. Many institutions are asking the physician to decide if an elective procedure should be deferred, and their
Mm-hmm.
name goes on it, not the
Right,
institution. And that
right,
is a huge problem because, yeah, I mean, probably there's a lot of procedures that can be delayed, deferred for the short run, but out of the millions across the country, one or two of them, a percent of them may have a bad outcome that has nothing to do with it. And right there, it becomes an issue for those physicians. So I agree. I
right.
think there should be, or maybe there should be a federal law basically providing immunity during this time span because it's a national crisis.
Right. I mean, we're already worrying about dying and leaving our kids and our families without, you know, a parent.
Right.
And like that is not something we need to be worried about right now, you know. And unfortunately, that's the situation in the United States, you know, that's how our daily life is as doctors, which contributes to burnout, you know.
Yep.
all of the um all of the responsibility is shoved upon us for decision making, which is fine. But in kind of in this sort of situation where it's a national problem, a national shortage, nobody wants to let anyone die,
Right.
but that might happen now because of the situation that we're in, you know. To blame the doctors for it, I think it's just
Yeah.
wrong.
And on the flip side, like you said, we're having disjointed policies. So some people still say, yeah, you can go outside and
Mm-hmm.
do what you want to do or open businesses back up. And other people, the medical community pretty much unanimously has said, no, we need to be, socially distancing, whether the rules are coming federally or not. We need to, in
Mm-hmm.
order to flatten the curve, right? That was exactly what we've been talking about for the
Right.
past 3 weeks. And it's it's following upon deaf ears, and then on the flip side they want to sue us directly. It's like,
Right.
what is,
Yeah, exactly. And it makes you ask, like, why would we step up then, right?
yeah, yeah,
If we're just gonna risk our lives and our families just to be sued in the
right,
end, right?
right.
Like, what's up with, like, why we need some protections
So
here? We need some guidance.
I think in New York they did pass something about, I didn't look at the details, but there's something that Governor Cuomo did there about immunity during this time span, especially if you're
I haven't
practicing
seen that.
outside of the field of your expertise, because they're wanting,
Right,
OBGYNs to work in the ICU or, stuff like
right,
that, because they just don't
right,
have enough people. And so,
right, right.
you do have to provide people with, immunity in this scenario because you just can't otherwise.
You just need people in the front line, and that's, yeah. Um, yeah, I think there's a lot. I heard something about Spain saying that anyone over 65, I want to say, is just not getting intubated
Yeah.
if they have COVID.
Wow.
Just get, yeah, right.
I know.
But that's just a rumor that's not verified at this point. But
Yeah, we're hearing a lot of the same stuff. I've heard it from England. I've heard it from obviously Italy. We kind of know that they've been in that scenario.
hmm
Uh, there is one debate though that people trying to figure out, like, why are some countries faring better? Germany seems to have a lower death rate. The U.S. so far does have a lower death rate than Italy or Spain.
Mm-hmm.
And I'm not, I don't know that anyone really has an answer. Our death rates are probably more in line with
Let me pull
China's
up the numbers
reported
here.
death rates. Um, but I don't know that anyone really has an answer of why. But then some people who are saying, well, that's why we shouldn't be socially distancing. We should be fine. And I'm like,
I,
yeah,
yeah, I can't
I
even.
know that's the thing. I can't. That is the encapsulation of exactly how physicians are feeling right now. Is I can't. Um,
Literally cannot battle the world
yeah,
right now. Just
yeah,
trying to get a control on my emotions, my fear of
right,
going into work, and making sure I do a good job.
yeah.
Um,
Uh,
yeah, looks like in the United States, and just pulling up the numbers. Have you gone to this COVID info
the COVID tracker.
site? Yeah.
Uh,
Let me see
Here, let's
if I
see.
can share this.
Yeah, you can. You should be able to share it.
You seeing it?
Yep.
All
Okay.
right. So Americas, and then United States. Here we are. So we are up to 81,071 infected and one thousand
Or
two
is it?
hundred
Wait.
twenty-six.
Wait. Oh, I'm seeing a different number. What am I? I'm seeing 97,000.
Are you on COVID info?
No, no, this
COVID
is yours.
19
I'm
info?
seeing on your screen.
Oh,
U.S.
where are you seeing
confirmed.
that?
That purple number. Oh, I see.
Yeah. I was,
Up higher, it says in those boxes. Uh,
oh, right. Those
yeah,
numbers are different. Huh.
yeah,
Interesting. It might just be where I'm clicking and
yeah. So I
then,
think the
yeah, over
higher
there.
number is
So this,
actually
yeah,
more,
right. 80,
probably the most
97.
accurate.
Yeah.
Yeah.
Yeah, you're right.
So yeah,
97.
but it's what 1.5% death rate, But some people are saying, well, the reason Italy has such a high death rate is because they've pretty much labeled everything as COVID. Other people are saying the U.S. and maybe some of the other countries were labeling pneumonia as pneumonia and not COVID, and partly because certain people may have had COVID and their test results haven't come back in, then they died. They're not going to bother running those. So I think the truth is obviously somewhere probably in the middle of that. But regardless, even if it was 1.5%, that's pretty significant compared to what everyone likes to say is the seasonal flu. You know,
Right.
uh,
Right. Right.
so yeah.
I don't know. Scary times.
All right, so let's talk a little bit about the markets and what's happened. I know it sounds terrible, but we both do financial stuff on our my podcast on the blog.
Right.
So this week was the most uh, schizophrenic week in the market.
Mm-hmm.
In probably 100 years or at least 90 years.
Yeah.
Monday we were down at the end of Monday. I think we were down like 30%. Then Tuesday, Wednesday, Thursday went up, 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 and then today down again. Um, each of those days are about 1,000 points or more in either direction. So um, you know the markets, at least going back to yesterday, people were like, well, I think the markets have seen the price in the impact of coronavirus. And I thought it was a disconnect, right? I thought it was like, well, I don't understand how it's possible yet, because the scenes from New York that we're now seeing we haven't seen that elsewhere in the country. Maybe the nursing home in Seattle, but we're expecting to see them as physicians. We're expecting to see similar scenes play out across the country.
Yeah, I feel like the coronavirus thing has just started. And there's a lot to be seen yet, as far as negative impacts go. But yeah, we're swinging right now, and part of the swing was from the stimulus package talk, and people feeling like they'd be just confidence, investor confidence going up and down during the time. But yeah, I think the real economic impact of this virus is probably not going to be felt for another month or two.
I think so, because we just saw unemployment claims spike, from virtually the lowest point they've been in our history, or at least in the recent history, to like
Mm-hmm.
3.5 million. And this was really just week one or maybe week two of people's, staying at home.
Right.
and job losses, there's going to be a huge number of people and businesses who may, businesses who tried to keep people on for the first few weeks are probably going to have to start letting people go the longer this goes. And so,
Right.
yeah, it'll be a huge impact in the next 2 to 3 weeks.
Yeah.
So I don't know. I'm not rushing into the market. Don't get me wrong. I'm not trying to time it either, but people ask and I'm like, well, I don't think we've seen the bottom yet.
Yeah.
That doesn't mean I'm going to know when the bottom is, but I just don't think we've seen it yet. So.
Yeah, yeah. I mean, it's a tough job to try to stay the course right now and
Yeah.
just keep doing what you've been doing, because
And that's the smartest thing to
feels
do, is to keep doing exactly what you're doing.
right. It feels so scary. It feels like there's a meteor heading towards the earth and everything's going to be wiped out. You know what I mean? But like most likely not, right? Most likely that's not going to be the case. Most likely we'll make it through this. And so we just need to keep emotion out of our financial decision making and try not to pay attention to the market as much as possible right now, because it's insane.
Yeah.
Like you said, so I mean, the things that you can do, the good news for, like, there are good pieces of news, like some, if you lose your job, then the mortgage, you don't have to pay your mortgage, you can get a waiver for that. You can't be evicted for 90 days, at least in New York. Your student loan interests have been student loan payments, if you have federal loans, are frozen for 6 months, so you don't have to pay your student loans, and that's not accruing interest for 6 months.
Oh,
that's
nice.
pretty
Nice.
Yeah. And if you are making payments, I believe it goes straight to your principal. So if your whatever monthly payment, if you're able to keep making it, will go straight towards principal, which you can really maximize usage of. And because the interest rate environment is so good, mostly you can get actually a good interest rate. Sorry.
Someone's home.
There are a lot of people out walking. This is like a daily thing, right?
Right.
Now the dogs are like so entertained. That's another positive about
There
this
There
pandemic.
we go.
They don't know what's going on, but they freaking love it.
They love it. It's funny. I did a poll about some of the positive things that this social distancing has led to, and that was one. People get to spend more time with their family and their pets.
Yeah.
And then people. This is applicable to you. People are embracing their inner frugality.
Yes.
So
right.
This is your time to shine.
This is my time. Yeah, that's it.
People getting haircuts at home.
Yeah, I know. I'm like, I have so much material I can write about right now. I just can't even keep up with my brain. Yeah. I wanted to finish that thought that even if you had refinance already and do have a private lender, the private lenders are not applicable to this stimulus bill, but because the interest rates are still so low, you may be able to get a better interest rate, in this environment. That's a positive. So you should shop around for that. The mortgage interest rates are doing some funny stuff right now. Initially the refinancing, because of the environment, the rates went really low. And then they rose significantly because the banks were, I think, so inundated with refinance requests that they don't need to go that low. And I think the mortgage rates are more also based on 10-year treasury yields. Don't ask me to explain that. But it doesn't have to do it directly with the Fed. So anyway, so lots of stuff going on, but trying to keep positive, trying to just focus on, okay, so we're not confined to the house. We get to spend more time with our family, just changing the mindset. Oh, there's my little guy.
There you go. Good. All right, well, we'll end on a positive note. That was good.
Yeah.
I think one of the last thing that I'll say, the positive thing, that the physician community as a whole has come together. We tend to be very disparate, in different specialties and things like that. And it is one really good positive I've seen, because we're all going to be impacted. We've all kind of come together. There's been a lot of cooperation between specialties, some people sharing really, ingenious ideas in how to get around the lack of people. So these are some really good positive things that that I want to say, that, congrats to all physicians for doing that, because it's been a tough time, and, we'll get through it. Stay safe.
Let's make a union. Let's
Yes.
form a union.
Well, I don't know if I'll agree yet, but we may get there. All right.
All right, guys.
All right. Thanks for joining us, everyone. Stay safe, Disha.
You
And
too.
all right, we'll see you next week.
Take care.